So the scapula can do tons of movements. It's that unusual functional joint, the scapulothoracic joint, and all the other shoulder joints are attached to it. And all of the movements of the scapulothoracic joint influence and accompany the other movements of the shoulder complex. So super interesting. We talked about scapular elevation, depression. Now we're going to talk about scapular rotation and protraction. Wait, protraction is that way. So the same things about the same learning objectives about knowing the origins and insertions and actions and innervations. But now we're going to add a couple other little nuances. Scapulohumeral rhythm, it's the combined motions of the shoulder girdle and the glenohumeral joint. And we want to know about it, what it is, and it's significant to shoulder girdle function. We'll talk about it again as we talk about the glenohumeral flexors and abductors. As a group, you can also talk about them as elevators because we're elevating the upper extremity. We want to talk about, when we talk about shoulder scapula protraction, there's only one protractor muscle. And when that muscle's weak, it causes scapular winging, which is where the vertebral edge of the scapula pops out instead of colliding along the edge of the thoracic curve. And where we'll talk about the muscle and which nerve innervates it. And I have a little mnemonic to help you remember it. Nice, right? So upward rotation of the scapula, it's an important component of upper extremity elevation. So if we want to pick the fruit from the tree, we got to be able to get our arm up high enough to do it, right? So the upward rotation of the scapula is created by a force couple generated by the serratus anterior, the upper trapezius, and the lower trapezius. These muscles all have very different lines of pull, but they all rotate the scapula in the same direction. So it should be called a force triple, but you know, that's nitpicking, isn't it? So the diagram from the book, it shows the upper trapezius is moving the scapula. It shows it this way, is elevating the scapula, the lower trapezius is depressing the scapula, and the serratus anterior is protracting the scapula, resulting in that rotary motion of upward rotation. So it's the analogy that they use is like a steering wheel. One hand is pulling up, one hand is pulling down, and you're getting the rotary motion of the steering wheel. And that is a very apt analogy because it's the same thing. The upper trapezius is pulling one way, the serratus anterior is pulling another way, and the lower trapezius is pulling the other way, producing that rotation, upward rotation of the scapula. Okay, so the upper trapezius, just to review, it does a bunch of other stuff too. And we'll keep talking about the upper trapezius ad nauseum. You're always dealing with the upper trapezius, so we'll talk about it forever. Remember, its origin is on the, not on the back of your head, the external occipital protuberance and the ligamentum nuchae, which attaches to it. The neck ligament, you can think of it that way. The lateral third of the clavicle and the acromion process. So it's the string that holds your shoulder up, holds your scapula up, so the glenoid fossa is slightly upwardly rotated. It does that scapular elevation, and as part of the force couple, it does upward rotation. It does the upward part of the force couple. And it's innervated by spinal root, the spinal root of cranial nerve 11. You don't need to know the spinal root part. Cranial nerve 11, it's the spinal accessory nerve. The serratus anterior, it attaches, it actually is anterior to the scapula, so that's something to remember. So it's between the scapula and the rib cage. And its origin is the lateral external surface of the first 8 ribs. So it has these fingers that go out to ribs 1, 2, 3, 4, 5, 6, 7, 8. And it has fingers going out. So when you see someone that's got a lot of muscular development on the side of their body, they have those little bumps, those little bumps on the side of their body. And that is where the serratus anterior interdigitates with the external obliques. So the external obliques are coming this way, the serratus anterior is coming this way, and they make those little ridges on the side of your body when you don't have them covered up with fat. So those are lovely little ridges when you don't have them covered up with fat. The insertion is the anterior surface of the vertebral border of the scapula. Well, isn't that interesting? So it's running anteriorly, it's coming from the ribs, and it's running anteriorly and attaching to the vertebral border. So you can see how that would pull the scapula forward along the rib cage, right? And because it's pulling on that vertebral border, that's what helps prevent the scapula from winging out. It is innervated by the long thoracic nerve. So the way I remember it is SALT, S-A-L-T, serratus anterior, long thoracic. SALT, that's our muscle and its innervation. So interesting muscle. When the insertion moves towards the origin, the vertebral border of the scapula moves forward on the ribs, moves anteriorly on the ribs, and that is scapular protraction. It is the only scapular protractor, but it also has that forward motion while the upper trapezius is pulling upward and the lower trapezius is pulling downward to perform the rotation involved in upward rotation of the scapula. Pretty cool, right? So the lower trapezius is the third part in the force couple. It has other actions, of course, but its origin is the spinous processes of T6 through T12, so pretty low on the thoracic spine. Its insertion is the root of the scapular spine, which is on the medial side of the scapula. It's part of the force couple for upward rotation and spinal root of cranial nerve 11, again, the spinal accessory nerve. So what goes up must come down, right? So when you upwardly rotate the scapula, then you need to downwardly rotate it, get it back into place. So the primary muscles involved in downward rotation of the scapula are rhomboids, pectoralis minor, and levator scapula. The levator scapula and the rhomboids have, different lines of pull, but they can produce scapular motion in the same rotary direction. So the levator scapula is pulling up, pulling superiorly from the part between the superior angle and the root of the scapular spine. The rhomboids are pulling up from that vertebral border of the scapula medially and upwards. And the pec minor is pulling on the coracoid process, bringing the scapula down. So you get that downward rotation. So the combination of those three muscles produces the rotary torque for the downward rotation of the scapula. So why do we care, right? Well, here's why. Well, let's talk about review the muscles first, and then we'll talk about why we care. So levator scapula is deep to the trapezius, it's deep to the sternocleidomastoid. It has a reversal of muscle function, which we'll talk more about in the spine chapter, spine and neck. Its origin is the transverse processes of C1 through C4 in the cervical spine, so upper cervical spine. Its insertion is the vertebral or medial border of the scapula between the superior angle and the root. It does scapular elevation, and it's part of the force couple for downward rotation. It gets the dorsal scapular nerve. It's on the dorsal side, it attaches to the scapula. Rhomboid, deep to the trapezius, rhomboid major, rhomboid minor. Its origin is the ligamentum nuchae and the spinous processes of C7 through T5. So you can see there's a little separation between the lower origin of the levator scapula and the most superior part of the rhomboids. Its insertion is the vertebral border of the scapula between the inferior angle and the root, just inferior to where the levator scapula inserts. It does retraction because it has that medial lateral line of pull. It does elevation because it has that slightly vertical oblique line of pull. And it works in the force couple for downward rotation. So it's pulling the scapula medially, the levator scapula is pulling it superiorly, and the pec minor is pulling it inferiorly, giving you that downward rotation torque. Okay, so we'll review the pec minor, good old pec minor. It's the eora of muscles. Anterior surface of the 3rd through 5th ribs attaches up to the coracoid process of the scapula and pulls it down, giving you that 3rd component of the downward rotation force couple. And it gets the medial and lateral pectoral nerve just like the pectoralis major will. Okay, so here's why we care. Scapulohumeral rhythm, it's the combination of movement between the glenohumeral joint and the scapulothoracic joint and the other joints in the shoulder. So during normal shoulder elevation, so abduction or flexion, a natural 2-to-1 ratio exists between the glenohumeral and the scapulothoracic joint, meaning for every 2 degrees of glenohumeral abduction or flexion, the scapula has to simultaneously upwardly rotate approximately 1 degree. So when you get 180 degrees of shoulder flexion, about 120 of it comes from the glenohumeral joint, and about 60 degrees come from the upward rotation of the scapula. So if the scapula is fixed and doesn't upwardly rotate, the humerus is going to run into the acromion process, and you're only going to get 120 degrees of flexion. To get that full 180, you have to upwardly rotate the scapula, get that acromion process out of the way, and get that extra motion. It also has an effect on the deltoid, which we'll talk about when we talk about the deltoid. So that's our scapulohumeral rhythm. That's why it's important, because then we get our full range of motion in elevation. So abduction and flexion are both elevation. So for scapulothoracic protraction, I said that the serratus anterior is the sole scapular protractor. It's transferred through the scapula to the humerus, and it's used for forward reaching and pushing activities. So if you go, oh, I better shut that drawer, you have to protract your scapula. If you're going to punch the wall, you have to protract your scapula. Sometimes the serratus anterior is called the boxer's muscle because you have to protract your scapula to get full forward extension of your arm to punch something. Okay, so you can think of that as the boxer's muscle. So the serratus anterior, remember, it interdigitates with the external obliques. Its origin is the lateral external surfaces of the first 8 ribs. So it comes out in a fan and has those little fingers of muscle fibers. Pretty cool, right? And it inserts on the anterior surface of the vertebral border of the scapula. So that medial vertebral border. It protracts. It participates in the force couple for upward rotation with the upper trapezius and the lower trapezius, and it prevents the winging of the scapula. So there are some neck and throat surgeries where it is common to nick the long thoracic nerve. So if you do that, then your serratus anterior is weak, and it weakens upward rotation. You get scapular winging, and it weakens protraction. So if the nerve is damaged, we can't usually use the muscle, and we have to do compensatory actions. If the nerve's not damaged, you can strengthen the serratus anterior by doing the exercise that's called a push-up with a plus. So when you're in the up position of the push-up, you protract a little bit more, and that's the plus. That's your serratus anterior part. So winging is the medial border of the scapula lifting away from the rib cage, and it's a sign of serratus anterior weakness. When we're in the lab, look at your classmates' scapulae and see if anybody has any winging. So rehabilitation is designed to strengthen the serratus anterior, often incorporate that push-up with a plus. The exercise exaggerates that final phase of the push-up, which involves additional protraction of the scapulae at the end phase of the push-up. So when your scapulae are protracted, they're forward on the rib cage. So also try it when you're in a plank. Try protracting the scapulae and see what happens. It's fun.